When you look at communities, every community has a dining room, but not every community has consistency. Yeah, the amenities attract attention, but that initial trust drives the decision for a family. Family members are going to remember how they felt in a community versus what they saw.
Families forget floor plans. They forget pricing sheets, but they never forget how you made them feel. This week's guest believes senior living sales is really about emotional memory and that most communities are unintentionally getting it wrong.
Welcome to From Leads to Leases, a CCR growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
Welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of innovation, leadership, and care. I'm your host, Jerry Vinci, founder of CCR Growth, the only demand generation agency that is exclusive to the senior living industry. And through this podcast, I'm here to guide you through the evolving landscape of senior care, exploring the innovations, strategies, and leadership insights that are shaping the future of the industry. So whether you're a provider, caregiver, or industry leader, this show is here to help you make informed decisions and create meaningful impact. All right, today's guest is Mikhail Blosser. He's a multi-site sales manager supporting admissions and resident experience teams at Hilltop Senior Living in Colorado. Hilltop is a mission-driven nonprofit organization serving adults of retirement age through assisted living, memory care, independent living cottages, and specialized programs, including dementia day services and traumatic brain injury support. So Mikhail's work centers on relationship-driven admissions, coaching sales teams, and creating consistency across multiple communities without sacrificing empathy. He believes admissions professionals are not closers, they are translators, guides, and the first point of emotional safety for families navigating care decisions. So, Mikhail, welcome to the show. I'm so glad to have you here.
Yeah, thank you for having me, Jerry.
Absolutely. What a important and vital topic for us to talk about. I think there's still, unfortunately, some teams out there that I feel like they feel like once the sale is made, hands off, we're good. We're going to pass this along to the rest of the staff, and then they're never to be seen or heard again by that family. But I think you probably have a very different perspective. I wanted to just start by talking about before the actual tour experience. There was a data point that said over 70% of assisted living inquiries occur after a health event or care crisis, which obviously leaves families overwhelmed, underprepared to evaluate options. Families, they're often reaching out during that moment of crisis. They're not prepared, and that emotional tone is kind of set long before that tour ever even happens. So, in your experience, why is early discovery so important to help reduce the fear and confusion that people experience?
Yeah, absolutely. What I try to tell our teams is admissions really doesn't start at that front door. The discovery doesn't start at the front door. It really starts when that family realizes that something's changed. And fortunately, we just got through the holidays, Thanksgiving and Christmas and New Year's, where these families are coming out of town and visiting their loved one. And mom's not getting around the house as great as she used to be. And so that's like the first emotional trigger for a family member. And then it's one of our ways of figuring out what the emotional driver is for a family. And part of that is just listening to them and getting that like early discovery. It's to just lower the anxiety that families are going to have far before they even are being sold or feel like they're being sold something.
I've been in marketing for almost 3 decades, and through my agency, I've helped some of the largest senior living providers attract qualified leads and fill rooms faster while lowering their acquisition costs. But one thing kept bothering me. While working with larger communities, I kept meeting smaller operators, 10 to 50 bed communities that were struggling to compete with the big box providers because they don't have the same budget, staffing, or support behind them. And as a small business owner myself, I get that. You're wearing 5 different hats, you're trying to fill rooms while still giving great care, and that's exactly why we built Growthly. Growthly takes everything we've learned from helping large operators fill their buildings and makes it accessible to smaller communities without retainers, without long-term contracts or inflated costs. It's a performance-based partnership, and you only pay when we deliver move-ins. We help you stand out online, stop depending on referral agencies, bring in qualified families, and fill your community faster. Growthly is built for your small community and designed for big results. Learn more at growthlyseniorliving.com. Is there something that families are feeling, but they're not yet saying at this point in the experience?
Absolutely, a
Probably a
lot of
lot.
it yeah. Oh gosh, it goes back to dignity. They want to know that their loved one's dignity is going to stay intact, and even their own dignity. That's first and foremost. And then it really goes into, is mom gonna be okay at 2 o'clock in the morning at home, or is she gonna be okay and well loved on at 2 o'clock in the morning in your community?
And then I know no one would advise this, but you see this happen often is skipping the discovery. And then that creates this massive misalignment later in terms of what their expectations are and what the community offers or level of care, or even if the level of care increases or something like that that wasn't discussed ahead of time. How how does skipping that discovery create misalignment?
That's probably the biggest loss that most communities have in general, is not listening to understand the family and what their needs are, and just going right to, here's what we have in our community, take it or leave it. And that's when care teams miss out on specific cares that a resident's going to need, or a certain emotional impact that this resident has, or past trauma that the resident has experienced in their life.
Mhm.
And then the community introduces them to that trauma again, and now their experience within your community has downgraded.
Yeah, there's really no way. It's really, well, I don't see no way, but there is very difficult to get that trust back once it's broken.
Yeah, and that's where, is if the entire team inside the building is communicating and understands the goal for that resident, and each and every resident that's in the building, it's going to be uh, a far better experience, not only for the resident, but even your staff. Then that misalignment doesn't happen between staff members, and then those little qualms between each other don't happen. Then it's just a streamlined process, for staff, but then just a overall amazing experience for our residents.
I know trust is becoming more and more of a key component in terms of where families decide to place their loved ones. There's so many communities today. I feel like there's a new one popping up all the time in certain areas. So they look increasingly similar on paper. Same amenities, same dining programs. It's like what really sets them apart. It really comes down to kind of like the experience and the trust that's built and how early that's built. Have you seen that shift? Has there been a shift from people looking at amenities and features to now kind of like talking more about what's the experience, or trying to establish some sense of like, can I trust this team with my loved one? Has that become more to the forefront?
Yeah, I would say that's probably the bigger driver. When you look at communities, every community has a dining room, but not every community has consistency. Yeah, the amenities attract attention, but that initial trust drives the decision for a family. Family members are going to remember how they felt in a community versus what they saw. And so as many staff members that greet this family with a smile and just acknowledge them, they're gonna feel that more than that they saw the cafe down the hallway or the billiards room. And that confidence now comes from the connection, and not really comparing amenities in communities. It's what community made me feel good, and made sure that I know that my mom or my dad are going to be well loved, and they're going to be sought after, um, while they're here.
I mean, given your role as, as a multi-site sales manager, I feel like that's probably right in your wheelhouse. I mean, how do you help the team overall, admissions and resident experience team? Like, how do you help them build that rapport like right out of the gate?
Yeah, so one of the things that we really talk about within our team is that we're not salespeople. Yeah, our title may say sales or admissions
Hmm.
team, but really we're the translator for our community. So we've got to translate the complexity into clarity. So what does every role in our community do? One of our communities has 131 units in it, and we have over 100 employees on staff. And residents don't know who does what, where do they go. So it's our admissions team's job or role, and my role to coach, how do we translate that? How do we explain who does what inside the building and just remove the fear of that unknown in that aspect? And honestly, it helps just align expectations early to prevent that regret later. It's one of those, again, we communicate within each other, within our team,
Hmm.
and align those processes. So that way the guest experience is exactly what we tell them it's going to be.
I like the word translation because that's a big hurdle for families to overcome. I mean, nobody does searches or knows much about senior living before they need it, or they're almost in need of it. In your experience in terms of admissions and things, what is the biggest component of that you feel like you have to translate, or what's the most challenging thing to translate to families that they may not understand out of the gate?
That we're empathetic. That's first and foremost. We do this day in and day out, and we just had this discussion within our team. Is for us, this is our day to day. It's commonplace for us, but for these families, this is most likely their first time experiencing this, and they don't know how to navigate it. We do a great job as society educating our youth to prepare them for life and how to be a great professional, but there's not an education until it happens of what do you do when your loved one needs that help, and how do you seek guidance and a team to help you with that and not make you feel like you're letting down your loved one by not being a great caregiver as an adult child for your mom and dad.
It is big. It's so interesting to me that we haven't developed something like that yet, only because obviously everybody experiences this in their family. Even if, they're not connected to their family, they're going to experience it for themselves. Aging, there's no escaping it. It's something that happens and we have to deal with it and talk about it and figure out plans because we're not always going to be able to live the life, as we're living it right now. Mobility is going to be a challenge at some point. Cognitive decline could be an issue at some point. Like, what are we going to do when those things happen? So, having that planning in place is so important, or just understanding it, right? Like, understanding, going and sitting with someone like you who can talk them through what their options are. Because I feel like that's the other thing. People don't really even understand what options they even have.
Yeah. Yeah, that's a big one, and it's an education aspect for us and for the community. You're talking about the silent generation and their ideal of assisted living a lot of times is maybe a skilled nursing or a group home, and they really don't know what an assisted living or a memory care unit does or even independent living is. They group everything together, and so we want to listen to them, empathize with them, and then when we get that connection with you, now we educate. What does it look like? What does your experience, what does your care look like? What is your day-to-day life expectation going to be within our community?
I know part of the translation process is just kind of explaining and showcasing like the community roles, the rhythms within the community, the realities of what life in the community looks like. There's the other piece of it too, which is what the marketing team is promising versus what the lived experience looks like. How do you align those two components or make sure that it will be in alignment, that their experience once they get there will be what was promised?
First, we got to sit down as a team, and we are still a team. We may be lateral to one another, but realistically we work within the same organization, and so we should be speaking the same mission. So sales and admissions and operations, they can share their goals, and marketing shares their goals, and we figure out what the end goal is for that encompasses all three and work backwards from there. And one of the things that we really got to be cognizant of is the fastest way to lose trust with a family is just overpromising. And you know, sometimes it's marketing's job to promise everything under the sun, but if we don't back it up in our community, then we lose that trust immediately. So I think just overall talking it through and having an end goal and then breaking it up into phases is probably the most important for marketing and sales to align with each other to share that.
Yeah. Yeah, there was a study done by Nick Map Vision, and they said that the expectation mismatch is a leading contributor to early move outs, particularly within the first 90 days, which makes total sense. If the marketing team overpromised something and now they're experiencing what reality really looks like, they're going to feel that pretty quick. So that makes sense. Talking about consistency across communities, I mean, you're managing multiple communities. How do you ensure there's a cohesive message or experience? If that translating the experience to families is part of your overall goal, how do you accomplish that across communities where maybe there's different levels of care, or how does that differ for you?
Yeah, one of the things that Hilltop really pushes is that we're a people first organization, and that goes through employees, our community stakeholders. Outside of assisted living, we have 35 total programs under Hilltop, and we want to make sure that our area, our stakeholders in our community are feeling that message across the board, and so we've got to make sure that we're creating processes, one of the and it relates back to like atomic habits. And we've been bringing that book up a lot in our
Love that book.
conversations as teams. Yeah,
Yeah.
and we discuss, we have a goal. Do we have a system in place to achieve that goal? If not, what system do we need to put in place, or are we willing to have that goal? So one of the things that we're doing in the assisted living programs under Hilltop is creating what we're calling the Hilltopper VIP experience. And, it starts from that lead generation. So somebody seeks us out either through a case manager or online or a skilled paid service like a place for mom or Oasis. When they come to us, what's that first initial experience? And then, how do we nurture that lead and that family through setting up a tour and establishing a next step with them? And then from there, we hand off to our care team to do that assessment and really get the skinny on what is this resident going to need from us to live a good quality of life. And then from
Mhm.
there, our next phases are that move-in process and the lease signing. The lease signing needs to be an amazing experience too, and not just here's paperwork, sign it. We we've got to translate what the lease says, and from there, we give them the most amazing move-in experience. So they move in, and then the next 30 days, let's gradually introduce each of our team members to them. So environmental services is coming in and figuring out what does their housekeeping look like and what do they like? Do they like their linens a certain way? How do they like their trash picked up? Do they like certain dusting? Culinary, that's that's a senior's driver a lot of times is what
Big
does the
time.
food taste like?
Yeah.
What does it look like? And so we've got to present that to them. And if our culinary team has a relationship with every resident, that it just pushes their experience even further. And then, one that I've heard a lot in the past is residents don't really know our directors, right? They know the life enrichment, the team, and they know their housekeepers and their Q maps or their CNAs or whoever it may be, but do they know their directors? So directors getting in front of our residents sooner, especially at that initial move in, is going to give them a little bit more sense of comfort too, and their family a sense of comfort. So that's kind of the process that we're going through right now to really establish an amazing experience for our current residents and our future residents.
I love that you talked about atomic habits too. I think that's such a thoughtful way to improve what it is that you're doing, or at least keep track of it. People sometimes have lofty goals and it's like this pie in the sky idea, but they have no concept of how to get from point A to point B, right? And I like atomic habits because it's like a micro accomplishment. It's a 1% gain. Like if you improve 1% every day, what does that look like by the end of the year? it's massive and it's achievable because that's just a micro adjustment, as you go. So I love that you're implementing that.
Yeah, absolutely. And we touched base on that yesterday with the team. Just in the last 60 days, our actual occupancy rate has raised 6.5%, which is amazing across our communities. But it's came from the intention and discipline of our admissions team and then the support behind them.
I love that. I love that. So you guys operating as a nonprofit, how does that experience differ for a prospective resident and their family versus a for-profit organization?
That I think it eases some of the anxiety, some of the barriers that those families and the residents put up immediately when you can proudly look them in the eye and say, you know, yes, you are doing private pay or you're using long-term care insurance, but that money isn't just going into a bank account or somebody's pocket. It's going right back into your local community through our other programs that Hilltop offers. So, you know, yes, this resident is paying X amount of dollars per month, but a lot of that goes back into like our Before Babies program or our domestic violence program or our houseless population and their program. So I think that speaks wonders to our community, our stakeholders, that they feel like their money is going into a good purpose on top of their care.
Yeah, I love that. I think it's really cool too that you guys offer the dementia day services or the traumatic brain injury support. I mean, that I would think that really bolsters you in the community that you guys have so much outreach and it's not just, you're not just focused on what's going on with the residents, but what's happening in the outside community as well.
Yeah, absolutely. And talking about like our traumatic brain injury program, or it's known as the life adjustment program. It's a one of a kind thing. We're housing 90 folks that have had traumatic brain injuries between over the age of 21 years old, and providing something that hasn't existed anywhere else. And we helped write legislation for that support, which is an amazing feat in its own. And then our day program for our folks with dementia and Alzheimer's, or that initial onset, right? So, the the husband or wife doesn't necessarily want their loved one to move into a community and be in a secured area or what we have as a companion care. They're not ready to do that yet. But they also need that little break from being the caregiver for their spouse, and that's what Senior Daybreak offers for them, which is tenfold an experience that a lot of people aren't able to get.
Yeah. Oh, caregiver burnout, it's so real and it's almost like a unspoken epidemic in this country. Often because it's family members doing the caretaking and they're not getting paid to do it. So having options like that, I think that's amazing that you guys do that. I love that.
You see that spouse that that's 92 trying to help their 94-year-old spouse, and they end up having a fall because they were trying to help the other spouse. It's
Yeah.
just
Yeah, my
yeah,
parents are that story exactly. My mother hurt her knee and my dad was helping her up the stairs and then he hurt his back helping her up the stairs. I'm just like, "Come on, guys. Like this is
yeah.
not working."
No, find the
I want to
solution.
talk about I want to talk about the referral relationships that you have. I know that referral partners they're so vital to an effective sales team to maintaining your census. And I know that referral based leads they're usually converting at rates up to 3 times higher than paid digital leads or third party leads from say like a place for mom or something like that. What do you think matters to referral partners? What makes them want to refer people to your communities?
An intentional relationship first and foremost. Is we can put together 70 mugs and take them out to folks full of candy and drop our business card, but that doesn't resonate with them, and it certainly never has resonated with me when an individual does that. But I go in with intention of building a relationship with the individual and really get to know them. You begin to know what sports teams they like, what their kids are doing on the weekends, and what's their hobbies and interests. And you go into those outreach meetings with that in mind, and really just being cognizant of what drives that individual, then it drops that barrier for them, and then you're top of mind every single time. If you can make life easy for them, then the referrals start coming to you, and then it goes in hand with physicians offices. We hear a lot of communities where maybe the physician's authorization is taken in by the family, and the family, it's an emergency for them, so they press continually for that physician, and it makes it hard on them or their MAs, where our admissions team can build that rapport with them and fax off that document, and then maybe establish what check-ins does that physician's office want? And
Hmm.
eventually that physician's office begins to start sending referrals because, again, we made their life easy and their process and their day to day simple.
If a sales team was exploring finally developing some kind of a referral program or reaching out to establish some referrals, I mean, what would be your first piece of advice to finding some new referral sources?
You know, uh, in our area, we're fairly fortunate where, Senior Blue Book, it holds monthly luncheons where a lot of the admissions coordinators go out and meet. But then we kind of take it upon ourselves to establish like support groups for, case managers, and because they're all living the same experience, they're just in different buildings. And so I think those are up up front, probably creating those two, and then really just getting to know who's in place in each building. Sometimes it's easier to make a connection with what a frontline case manager before going to the senior case manager or the director of case management or social services. Um, and then it just slowly bleeds in, and you resonate with them, and they go, Mikhail came in and he was amazing. You should meet him. And so the next time that individual, and then it starts to spread and trickle out to the rest of the team inside each building that you're visiting.
I love that. Yeah, no, that's smart. That's a smart strategy to not necessarily go for the top, the head right out of the gate, Start get your feet in the door somehow and then kind of work your way up the chain. I like that.
Yeah, it takes time, but that's what a lot of us are hired to do, and what our primary focus should be is establishing as many relationships as possible. And sometimes we skip some of the most important people, and that's the folks that are working directly with patients and residents.
Yeah. Talking about the sales and marketing team, I know earlier you had mentioned how both teams need to be focused on the same mission. 100% agree with that. In fact, I look at the sales and marketing team as the acquisition team because everybody's working towards the same goal here. Just a handoff has to be smooth. But it's interesting, only in healthcare, only 22% of organizations report like a strong relationship between or alignment between sales and marketing. And I think in senior living too, one of the challenges we see because we manage communities in what is it, 24 states now, I think, in Canada. So we see it quite a bit that there's this belief system out there that it's all about how many leads you have coming through the door. And if we have X number of leads, we'll get X number of tours and then we'll get X number of move ins out of that. But for me, it's like it has to be about the quality because we can or, if you're using a third party referral service, for example, like one of the big ones out there, a place for momcaring.com, something like that, they're going to send leads to you that are not necessarily qualified. And then your sales team is now burning hours upon hours with prospects that aren't even a good fit. I did a survey back in, I think it was 2024 now. I surveyed 30,000 sales professionals in senior living and asked like, how long do you spend with a qualified prospect? And over 75% of them said 15 hours or more. So I'm like, if you're getting focused on lead volume and not lead quality, how in the world are you spending that quality time with each of those prospects? There's just no way. Right. So it's got to be about quality first.
Yeah. Yeah, and that starts with discovery process, I think, on the admissions and sales team side, but with marketing and sales working together, it's really establishing that messaging, right? And so, like, one of the things that we are implemented for 2026 is that marketing calendar and event calendar. So we establish 12 events throughout the year that we want folks to come to, and some of them are satellite based off of one of our communities within the organization, and then some of them are signature events that encompass all of our communities. And do we focus it on our warm leads, our hot leads? Do we do it as a community stakeholder? Do we look at our donor list? What audience are we trying to tackle for each
Hmm.
specific event? And again, we can't just blanket it for every single event. It's got to be event specific. And so as long as the teams are communicating and really having a set meeting that is intentional for that purpose, I think that messaging becomes clearer, the processes become clearer, and then the experience for our stakeholders and then our staff becomes better.
The sales and marketing teams, I mean, how do you close the feedback loop? Because I feel like that's another challenge. Marketing hands the leads off to the sales team and then never hears about what happened next, you know? Are they getting feedback from you guys about which leads are working, maybe which channels are generating the best leads? Like how does that feedback loop work for you?
Yeah, so one of the things we're being very intentional right now with tracking how many inquiries we're getting per day, how many tours, lease signings, move outs, and where are those leads coming from? And we're cutting them into different buckets. So did it come from one of our professional outreach sources? Did it come from a paid source? Did it come through Google? Did it come through word of mouth? Where did it come from? Our admissions teams are being intentional with asking every single time, hey, where did you come from? Because it is important for us to know, especially when we start getting into the talks about budgets and the operational side. We've got to make sure that we're spending our dollars wisely and in the correct areas. Otherwise, we're just throwing darts at a map and hoping it lands in where we want to go.
Is there a specific channel that you find more success with? And maybe it's not the number of leads, but maybe it's the percentage of leads that convert to tours or convert to move-ins?
Absolutely. Obviously, it's outreach first and foremost. I mean,
Yeah.
it may not be the volume, but quality of lead, especially when we establish relationships with these partners, it becomes clear. And then the admissions process now becomes short and it could be a quick turnaround versus those elongated ones where you're trying to rediscover this person because maybe the agency that they went through didn't do a good discovery, and so you're getting a completely wrong picture of the individual. Or, folks are not sure where to go, and so they just hit Google and they land upon you, and then maybe we aren't the right fit, or we're not the age demographic they're looking for. So I would say the outreach partners are first and foremost the most quality and high converting leads that we
Yeah.
get.
That makes sense. I think the last segment here I want to talk about is the first 30 days and why they matter more than the move-in day itself. Almost like when you hire someone in your organization, you don't just hire them and then the goal was to get someone filled in that position, but then that's it. We're not going to train them. We're not going to do anything else. We're going to throw them to the wolves and hope they can do the job. You know, it's kind of the same with residents. Like it's moving, it's not the finish line, it's the beginning of kind of building that trust and reinforcing that trust that you've already built. How do you avoid overwhelming residents like when they first move in? What does that process look like?
Yeah, like our Hilltopper experience that we're rolling out and working through right now, I think really addresses that where, you know, day one, a lot of communities and enterprises, they do the big red carpet rollout where they're bombarded with 30 staff members right away with bells and whistles. And you're talking about individual that just most likely had an occurrence and their energy is depleted, and so that overwhelms them immediately. Where maybe we simplify that a little bit more and have more of that like intimate relationship and welcome with them, where we get them settled in and ask what they need and be intentional with our ask there, so that we're intentional with addressing their need right then. And then the next day we bring in our care team, and care teams want to have everything set in stone first and foremost and have everything laid out. But really, the care team is the one that has to probably pivot the most out of anybody in our building because things change day to day. We're talking about a human being, yeah, and not an inanimate object, so that next day is probably just care team coming in and spending quality time with them and getting to know this resident, knowing when they bathing, and how do they like their hygiene, and when do they like to get dressed, when do they like to get up, and really shape their care plan around that individual and not just a cookie cutter, this is what I learned in school. And then from there, we just slowly roll out each team, like I mentioned earlier, and that department head coming in and learning what they like in culinary, what's their favorite dessert, what's their favorite meal. Maybe we can cook that meal one night for them in their first 30 days and introduce it to the community as like our daily special. And then we just keep going down the line and introduce our environmental services and life enrichment. And
Uh-huh.
then, one of the things that I love about our communities is we really lean in on our resident ambassadors, and our resident ambassadors help ease that tension too in that first 30 days and invite them to activities and sit with them at lunch because, it's they're a lot like a little kid. You move to a new school as a middle schooler because your parents move across the country, you don't know anybody. We're doing the
Yeah.
same thing with a
Yeah.
senior.
It's kind of scary.
So
Yeah.
yeah, so we're gonna ease that tension and really lean in and make sure that their dignity stays intact and that they feel loved on while they're here.
That's got to be a lot to keep track of too on the staffing side of things, just because if this person has particular requests or needs that might differ from other residents, I mean, they're going to have to keep track and notate all of that stuff. So I would imagine if you tried to get all of that information all at once and hand it off to the staff, it would be overwhelming for them too.
Yeah, absolutely. But if we take just cut it into smaller phases for our staff and for the resident, it's easier to take on for both.
Yeah. Yeah. No, that makes sense. Mikhail, thank you so much for such a great interview and sharing everything you know here about this admissions process. I think this is a really interesting conversation. So thank you for joining us today.
Yeah, absolutely. I appreciate it so much.
Where can our audience go to learn more about Hilltop Senior Living or if they want to connect with you directly?
Yeah, so to learn more about any of our programs under Hilltop, you can go to htop.org. It has information, connections for each service director or a contact point for each. Or if you want to reach out to me directly, my email is mikhailb@htop.org, and I'll get back to you as soon as I can.
Cool. Awesome. We'll make sure I get that into the show notes for you. All right. So, as we wrap up today's episode, I want to thank you, Mikhail Blosser, for sharing your perspective on what families truly remember about the admissions experience, from reframing sales as care to building trust across multiple communities. Your insights remind us that occupancy follows clarity, empathy, and consistency. If you want to connect with Mikhail or learn more about Hilltop Senior Living, you'll find those links in the show notes. As always, we hope you found this episode helpful and grounded in the realities of senior living today. Be sure to subscribe on your favorite podcast platform and stay tuned for more conversations on leadership, sales, marketing, and the future of aging. And remember, From Leads to Leases is also a video podcast, so you can watch full episodes on YouTube or Spotify. I'm Jerry Vinci, founder of CCR Growth. Thank you for spending your time with us today. Until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Mikhail.
Thank you.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.